you don't have to do much with the flow. Just decrease the FR2, decrease the sweep gas, and then you have no problems. But for VA ECMO weaning, that is you have to decrease the flow, because VA ECMO is you have unloaded the heart, so you have to start giving some load to the heart. So previously heart was contracting with only 25% flow to that. Now you have to gradually keep on giving 10% flow more to the heart and see how the heart is loading, and that process what we call is a weaning process. So now when you are weaning this patient, you have to monitor different parameters. The important parameters that are is whether three vital parameters: patient is developing tachycardia, whether patient is maintaining mean arterial pressure, whether patient is maintaining tissue perfusion. So that all factors are very essential when you are weaning this patient. And so that all factors are important when you are weaning this patient. Then the important factor is going to be to assess the heart. So for that you need to have echocardiographic parameters also. So in echocardiography, what you are looking at is you are looking at the whether there is any issues with the ejection fraction, how much is the ejection fraction, whether there is any MR, whether there is a chamber dilatation. So you would always see that there should not be MR or there is a mild MR. There should not be ejection fraction should be more than 30%, and your LV is not getting dilated. And when you increase the load on that, you have to see that how it is behaving. If by increasing the load, if you start developing MR or your ejection fraction start coming down, then that is not a good sign, and then you have to stop weaning at that time. Also look at the VTI and TDSA. The more reliable factors out of all weaning trial, they said is VTI and TDSA. Those patients where when you start coming down on the flow, and if their VTI is showing a rising trend and TDSA is showing rising trend, they usually have a successful weaning efforts. And those who does not improve or those whose VTI decreases, they usually don't have, well, there are high chance of weaning failure in that case. Okay. Now the next step is once you have come down to a flow of say 1 liters, that is weaning has been done, and next step is trial off. So what we are going to do is in trial off is, now for this trial off you require a bridge to be made and connected. So this bridge has to be, as I told you, it's close to the cannula, as close to cannula as possible. What you are going to do is you are going to separate the patient and ECMO. Okay. So you are going to separate the patient and ECMO. Okay. During this process. So I will show you how to make a bridge and how to connect the bridge once the patient is on ECMO. Okay. So you need to know how the patient is going to put a bridge first, and once you put the bridge, then you have to disconnect the patient from the ECMO for some time. Okay. So just a minute, I'll show you how to make the bridge. नीचे 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 हाँ अभी ब्रिज दिखा देते ना, ब्रिज दिखाने को. ओके यस हाँ, ब्रिज कैसे लगाने दिखाने का. Okay. So now I'll show you how to connect the bridge if it is not connected to the circuit. Okay. For connecting the bridge, you have to disconnect the circuit for some time. But again, this patient will tolerate because the patient is improved and he is tolerating weaning, so he will tolerate this. So okay. Okay. So see to it that there is no air. Connect the bridge as close to the cannula as possible. Okay. Both the venous side and arterial side. So what you have done is you have connected the 3x3 straight connectors to the circuit with a lever lock connections. Okay. 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 You have to you have to de-air the bridge also before you connect. Okay. You can use 3-way also. For connecting this bridge. And once you have connected it air free, you can always use this 3-way to aspirate and see there is no air. Okay, on either side if there is air you have to just de-air it. एक साइड खोलना पड़ेगा देखो. So once de-airing has been done properly, then you have to release the clamp. Okay. First, always when you release the clamp, release the venous clamp first and then the arterial clamp. Okay. And you have to keep the bridge close. So now once this has been done, so when you start weaning, give a trial of, what you need to do is you have to, for clamp, whenever you want to come off ECMO, first always clamp the return line, open the bridge and close the venous line. So now what is happening is there is nothing going to the patient, nothing coming out of the patient, and there is a flow which is going on inside the circuit only. And the flow which was 3 liters now come down to 1.3 liters because it is moving only in the circuit. It is not going to the patient. The bridge is small, so the volume is going to get less. Okay. So now you have to wait for 8 to 10 minutes like this. The circuit, the blood is recirculating the circuit, so circuit won't get clotted, and there is a venous and arterial cannula clamp. Now after 8 to 10 minutes, what will happen is, then you have to release the clamp so that whatever the blood is connected in the cannula get washed off. Otherwise there will be a tendency to become clot there. So after 8 to 10 minutes, what you need to do is go reverse. So release the venous clamp first. Okay. Clamp the bridge and release the arterial clamp last. Okay. So the now blood is coming from the vein and going back to the artery. Wait for 15-20 seconds so that whatever the blood is accumulated in the cannula is get washed off. Again, put a clamp on the vein, release the bridge and put a clamp on the artery. And you have to keep on doing these steps repeatedly for almost 1 hour every 10 minutes. Okay. Now, when this we are given a trial of, there is a high tendency to clot formation. So, in that case, you have to increase your target ACT to around 200 to 220. That should be your target ACT at that time. And you have to monitor ACT both of the patient as well as of the circuit, because patient is going to now separated from the circuit. So, both patient ACT and the circuit ACT is to be monitored. Do ABG at the half an hour, 1 hour and 2 hours time to see the lactate levels, how the lactates are. Do echo before trial off and do one echo after trial off. Say after 1 hour you do one echo and see how heart is tolerating. So you are looking at hemodynamic parameters that are fine. You are looking at the tissue perfusion, that is by the lactate, that is fine. And you are looking at the heart at the end of 1 hour to see how heart is tolerated in this trial off. So to look at the same parameters like ejection fraction, MR, VTI and TDSA. And that is where, if that is also fine, then you feel that yes, this patient is now fit for decannulation. Remember, decannulation for the VA ECMO is going to be done in the OT by the surgeon. So you have to be mindful about that. You have to call the surgeon and get an appointment, get the time, what time you can decannulate. Now, suppose that decannulation is not possible immediately. What you can do is, you can always go back on the ECMO flow, say around 2 liters of flow, and maintain the patient on ECMO. And then when the surgical team comes, you can take the patient for decannulation. You cannot keep the trial off, or you cannot keep the patient on very low flow of 1 liter for a longer time, because there is a risk of thromboembolic phenomena. At the same time, you are in VA ECMO, so the emboli can go to the systemic vessel and it can give us to either CVA or gangrene. So you have to be very mindful about that. Again, I am repeating the step. When you want to come off ECMO, when you want to go on ECMO, release the venous line first, clamp the bridge, release the arterial clamp. So you are draining now. You can see dark red blood, and your return is bright red blood, and that is what you have to do it when you go on ECMO. When you want to come off ECMO, let's remember, release the clamp the return line first, so that there is no question of backflow. Close the open the bridge and close the venous line. These are the steps you need to follow for the trial of VA ECMO.